Hi everyone, welcome to week 10 of your Medical Language 1 course. This is the final week of the course, so just a few updates, reminders. Make sure that you have everything turned in by Thursday of this week. It's very important that you have everything in by the end of the day on Thursday, as I have to post your grades on Friday. So if something's not in there by Thursday, it will go into the gradebook as a 0. If you are missing anything other than a discussion post, you may still go back in and turn those in. So you can still turn in assignments. You can still turn in, the weekly grids with the drug names. You can also still turn in any quizzes. So make sure that you work on getting those completed and turned in as soon as possible. This week we are covering just one chapter. There's no assignment that has to be turned in with regards to this chapter, but I would still recommend that you go through and familiarize yourself with the work at the end of the chapter. So go through and look at labeling the parts and and learning those different disease states and some of the drugs. Because again, even though it's not you're not doing an actual assignment on it, it is still very important information. So this chapter that we're going to be covering this week is the male reproductive system. So you're going to want to make sure that, as usual, you are familiar with the structures and the functions of all of the different parts. So this includes both the external genitalia and the internal genitalia. So you're going to want to make sure that you understand the functions of all of those pieces and parts. So the other piece that I want you to make sure that you know, just like with all of these chapters, is make sure that you're familiar with some of the problems, the disorders and disease states that go along with this particular system. Probably one of the most common things that you're going to hear about, run across, see when you're filling prescriptions is things having to do with the prostate. Cancer of the prostate is the second most common form of cancer in men. And once men hit the age of 50, many of them have problems with benign prostatic hypertrophy, which is just an enlargement of the prostate. And so that enlargement of the prostate can cause lots of problems. It can cause problems with the urinary tract, and it can also cause sexual dysfunction problems. So you're going to see treatment for what we call BPH quite a bit in those men over the age of 50. And then as far as the prostate cancer goes, there are a lot of different treatments for prostate cancer. Prostate cancer is not, I guess you could say, one of the most deadly forms of cancer that are out there nowadays, but it is a very common form. So we have a lot of good treatment options for those men who suffer from prostate cancer. So again, make sure you're familiar with some of the terminology, some of the parts and pieces and things. But again, mainly knowing those pathological conditions, those disease states, and things like that. A couple of them I wanted to point out to you when you look at the charts. This third one on here, for those of you who are unsure, that is pronounced canker. So that is just any type of a lesion. Typically, in this case, they're referring to lesions that form due to syphilis. So a lot of the conditions that you're going to see in these charts are related to sexually transmitted diseases. So in this case, we've got chlamydia. On this slide, they're talking about herpes, genital warts, gonorrhea, and those types of things. Then you're also going to get into things like impotence. So anything having to do with the ability to obtain or maintain an erection falls into this particular category. Another one is syphilis, like we mentioned before. One example, and I think I must have passed it up already, that I wanted to bring to your attention was where's it at? Oops. Hydrocele, there it is. I missed it, went right past it. Hydrocele is actually pretty common. Hydrocele is a fluid that accumulates around the testicles. And the reason I wanted to bring this one up is because a lot of times baby boys are born with hydrocele. And it's not uncommon at all. So that's why I wanted to point that one out. And then, of course, we have some of the different medications that are used to treat some of these disorders. We've got things that are used to treat the prostate, that enlargement that we talked about, BPH. Then, of course, we have the different medications that are used to treat erectile dysfunction. And here's a couple more that are included in that group. Then we also have some of those chemotherapy types of drugs that are used to treat prostate cancer. A lot of times you'll see that prostate cancer patients are treated with prostate enlargement medications as well as the prostate cancer medications. They kind of go hand in hand when we talk about that. So as you're going through this particular week, if you have any problems or questions, please make sure you reach out to me. And again, make sure everything is turned in by Thursday. Have a great week. It has been a pleasure having you in this course.